Failed back surgery syndrome is a term used to describe patients who continue to experience pain after spine surgery. Approximately 60% of patients who undergo traditional spine surgery suffer from failed back surgery syndrome. Mary Shephard from Augusta, Georgia, is one of those people. She had her first fusion surgery in 2012.
It was terrible. It hurt. At first it was okay, but then I started having pains with it. Anything I did agitated it.
The surgery seemed successful. I mean, it took a long time for Mary to recuperate. I still remember that. We had to rent a hospital bed.
When her pain didn't let up, her neurosurgeon recommended a second fusion less than 3 years later. That fusion was a bone graft covering Mary's first fusion.
After the first week, I couldn't walk. I was in pain. I couldn't stand. I couldn't do nothing. And for 77 days, I was in the wheelchair or the walker, from the bathroom to the couch or the chair. And that was my life. He had to put me in bed, and then his cousin had to come and stay with me during the day, and then he was home with me at night. And it was miserable. I was on so much pain medicine, and I was in tears.
Mary's neurosurgeon told her that there was nothing more that could be done for her and referenced her to pain management doctors.
We began to research pain management. We had never been to pain management, didn't know what it was. So we found an outfit that really got a lot of great reviews, and we went to see these folks, and they had accessed the MRI report. We had never seen the MRI report. And on the MRI report, it was pretty clear, even to a layman like myself, that she had a pinched nerve at the L5-S1. It's amazing how quick you can get educated on the spine and the nerves and where they're at and what's going on when you got a loved one in pain.
Armed with the information on the MRI report, the Shephards began researching spine specialists online, and that's when they discovered the Bonati spine procedures for failed back surgery syndrome.
We sent x-rays, MRIs, CAT scans, everything in. So they called back, probably about a week and a half maybe. And they said, yeah, we can fix you. Well, he called him first and said, your wife is a mess, but I can fix her. And then he called me right after that. And he said, honey, he said, you are a mess. He said, but I can fix you. He said, can you be in here Monday? I said, oh, Doc, I love you. We'll be in there Saturday. So we came in Saturday.
The Shephards reviewed Mary's MRI with Dr. Robert Uteg. His first priority was removing the hardware in Mary's spine.
And then he says, well, we've got to change it up a little. He says, I've got to get that screw out there. And we've got the screws. They're about 2 inches long. You can get them at Home Depot to repair your deck. She went in Tuesday, the next day, and he removed that screw, the hardware, which relieved a lot of Mary's pain. He says, sometimes that'll get it all, but he says, well, come back Thursday. And we went back Thursday. That's when we had the miracle. All her pain was gone, her right side, her hip, and down her right leg. And this is the type of pain that was killing her. She couldn't stand on it so bad. And she couldn't do anything. She couldn't take care of her home. You know, our home's 7, almost 8 years old, and it looks like we moved in it last week. Mary cleans every week meticulously. She couldn't do her duties at the office. She couldn't shop for groceries. She couldn't cook. She couldn't pet her dog. She could only sit in a recliner and go to the restroom with a walker, struggling. My cousin later told me it was tough. But thanks to Dr. Bonati and Dr. Uteg, she's pain-free.
Mary returned for several Bonati spine procedures and then underwent therapy to help her regain the strength she had lost after spending months using a wheelchair and a walker. She also had to slowly wean off the heavy pain medications she'd previously been prescribed for her pain.
When our doctors told us that Mary was going to have to live with that their surgery looked good, her films looked good, there was nothing they could do but send her to pain management, that's a death sentence. If it weren't for Dr. Bonati, she wouldn't have made it 2 years. Her heart couldn't stand that much medicine, and it's not like she can quit taking the medicine. We're in that horrible pain 24/7. I mean, we'd have to set the clock, to wake her up at 2 a.m. to give her medicine, because if she waited till 6 a.m., she'd be in such pain that, you'd want to take her to ER.
Mary's thrilled to return to her life before failed back surgeries.
This is True Blue, and I had the two best surgeons anybody could ask for. I was blessed. And everybody there was so nice. I mean, everybody. It's just amazing. It was a wonderful experience. And if anything ever happens to me again, we're on the first plane here, or if anything happens to him, we're up here in no time.